All right, welcome everyone to the virtual mental health awareness event and live stream. Today we have two members of the Counseling and Testing Center here with us, and they can go ahead and take it away.
Thanks, Kevin. All right, my name is Liz Emily. I'm one of the psychology doctoral interns here at the Counseling and Testing Center.
And I'm Corey Hirsch. I'm in my second year at the Cleveland State doctoral program, but I'm also a practicum counselor here in the Counseling Center at Akron.
All right, so today we're going to be talking to you a little bit about how to notice stress and mental health concerns, how to seek help for yourself or how to help others around you that you notice are struggling to seek help. Talking a little bit about self-care, coping, getting through hard times, and then an overview of our services as well. So just take a second to think about for yourself, what are some stressors going on in your life? There's a lot of different domains, friendships, family, school, work. Thinking about kind of all that you have on your kind of caseload right now and thinking about what that's like for you. So some of the, I guess, kind of definitionally, we talk about stress as being something that causes physical or emotional tension. Anything that's putting any kind of like physical stress on the body. And a lot of times we experience that in very kind of psychological ways. So maybe feeling really overwhelmed, maybe we feel really anxious, maybe we feel depressed. Maybe we have thoughts of like, I can't do this is too much to handle. I'm not sure if I can, make it through this, or I'm not sure if I'm going to pass this exam. Different thoughts in those kinds of areas. Behaviors, so maybe noticing you're changing, some things are changing for you. Maybe you're noticing like reaching out to other people less, or kind of feeling really lethargic and just wanting to sleep all day. Anything where you notice kind of on the outward things that might look different because you're feeling really stressed and overwhelmed. And then physiological symptoms is also really important. So, stress is something that is a very physical process in the body. There's the stress response that our body has when we're encountering different things that threaten our sense of well-being or safety or comfort. And so sometimes we, see those things come out in maybe having trouble breathing at times or feeling our heart is racing, feeling shaky or lightheaded. So there can be a lot of different symptoms across kind of like physical, mind, body sort of areas of life, and being really aware of what those symptoms are for you is really important to know when you might need to get some assistance in kind of managing some of those things, or when you need to put things in place for yourself that help you through those stressful times that maybe you wouldn't normally need. And it's important to know too that stress is kind of an underlying factor. It can be a trigger for mental health challenges, but it's not the only piece. A lot of times stress is, like I mentioned, sort of a trigger, but maybe there are other kind of underlying aspects that cause more mental health challenges. So maybe a sort of genetic or biological component, or maybe someone who's experienced a lot of difficulties throughout their childhood or their life. But stress is kind of a good way to open the door to talk about mental health because we all experience stress, and stress can be something that sets off more challenges for a lot of people. So just something to be aware of.
So when we talk about mental health concerns, the most common presenting concerns are usually anxiety and depression, and that's followed by relationship problems. We also see a lot of academic and career planning stuff coming into the counseling center. And recently, with the pandemic, we see a lot of adjustment issues and things surrounding COVID-19. As you see on the slide, suicide is the second leading cause of death in college students. So it's important to talk about prevention, because what we do at the counseling center is interventions, which is definitely helpful. But I think it's always more helpful to stop the problems before they start, if possible. And here are listed some of the most common stress reactions. And I think at some point in everyone's life, they experience stress. And some of these may look familiar to you and some of them might not. Some of them that you experience normally might not even be listed here on the slide. But that doesn't mean that they're not normal stress reactions either. With the fact that we all experience stress at different levels, it's important to keep in mind that when it gets out of hand is when we see the most issues coming into play. So when stress gets too much, that can mean it can spiral out of control into the anxiety, depression, and other mental health concerns that we see a lot in the counseling center.
So shifting a little bit to talking more about some of the warning signs. This is specifically an infographic that talks about warning signs of suicide, but I think they can also be thought of as just sort of warning signs that something is off, something is changing. So things to be aware of for yourself and others. So ideation is a term that we use in psychology to talk about thoughts. So when someone is having thoughts of like maybe kind of more passive of like, oh, it'd be nice if I didn't wake up in the morning. It'd be a lot easier, or maybe more active thoughts of like, I really don't want to be here anymore. So whenever we hear thoughts like that, we're automatically going to be concerned about that person's kind of sense of safety and well-being. Substance use is something else that comes up a lot. So sometimes it can be used as a way to sort of cope when things are really challenging and when mental health is something that's difficult to understand and identify and process. So, obviously substance use is not indicative of someone having mental health challenges, but could be a piece of someone's challenges in that area. When people talk about purposelessness, so feeling like they don't have a sense of, what's my purpose, what's my meaning, what am I working towards in life? When people start to talk about kind of losing that sense of purpose, we would be concerned too. Anxiety, so again, it's one of those things that it's not necessarily going to mean there's something more kind of risk or suicidal in nature, but sometimes with suicide comes that anxiety, so that sense of, overwhelming thoughts, constantly being kind of worried, or, I'm not going to be able to get out of this. Just lots of kind of anxiety and stress building up over time can be a problem for a lot of people and lead to something like this. When people talk about feeling trapped, so that they feel like they don't have options, that they're never going to be able to get over what the challenges they're experiencing now. Hopelessness. So again, kind of thinking about in the future, if you hear someone talking about, I'm not sure like if this is ever going to get better for me. I don't see this improving. Having not so much hope in the future. Withdrawal. So I kind of talked about that earlier about people who feel like if people start to feel like, maybe I'm not good enough for my friends and my friends don't really like me. And that behavioral side of starting to really withdraw from people, to detach themselves from people that care about them or supportive. Sometimes anger we see too. So I like to think of like the anger iceberg, that for sometimes, anger can be justified. Like if someone wrongs you, it makes a lot of sense that you feel angry. But a lot of the times we see anger come up as sort of like more of a surface level, when really what's underneath is maybe a lot of shame or guilt or frustration, depression. So maybe other things that need to be addressed too. Recklessness kind of ties into substance use, so maybe making risky behavior. So if someone is, driving recklessly or engaging in activities that could put them at risk, but there's a sense behind that of like they're not really worried, like they'd be okay if something didn't turn out right. And then mood change. So that's kind of what we often think of with suicidality most commonly, is when someone's really depressed or just not feeling well. And that we see, when you see a change for someone that in their mood that you didn't notice before, we would be concerned. So first, talking a little bit about for yourself, noticing when you might need to seek help. What are some things that maybe can help you through that process for yourself? So I think the biggest thing I want you to take away from this is that a lot of people are hesitant to come into counseling services because they feel alone. They feel like people don't understand. They're the only person that, is going through this. No one really is going to get it or be able to help me. Or maybe even feeling embarrassed. So feeling a sense of like, the thing that's going on for me, like, I don't want to talk about. Like, it's really hard to feel like that's okay and that it's normal. So feeling alone or embarrassed or shameful are kind of some things that often make people sort of hesitate to seek help, whether from friends or family or a counselor. So part of this slide is kind of talking about like, what do you say? So the biggest thing with that, I think, is kind of recognizing that for yourself, that, you're not alone, and that these are things that everyone experiences in some way at some time, and that we all deserve, to get the help that we need. And so being able to communicate that. So if you're someone that really is hesitant to reach out for help, to be able to maybe even talk to a friend first, like, hey, I'm really having a hard time. what do you think? Like, can I talk to you about this? Can I just like share a little bit of how I'm feeling? Or can you help me figure out what to do? Like being able to reach out and kind of be honest about what's going on for you can help you start to feel that process of I'm not alone in this. Other people want to help me. And then what to do. So sometimes the first recommendation would be to check in with an actual like a physician, because sometimes underlying depression we see things, or anxiety or other mental health concerns, there can be more of like a biological component, or maybe there's just something going on with hormone levels or nutrition levels or whatever it might be. So sometimes that can be a good place to start, just to see if there is something like that, and maybe what steps can be taken on the kind of physical side. And then with the mental health side, being able to reach out for the counseling center here or another mental health services, just to kind of figure out what makes sense for you and to try to make that first step, basically, and make the phone call and make an appointment and just see what happens and see what it's like.
Along the same lines of what Liz was just saying, because it can be so tough to sort of reach out individually for the help you need, it can also help if you notice the symptoms in other people to take a step to start a conversation with them. And that can be simply asking a question like the ones you see on the slide, which can at least get them to start a conversation, maybe give them the push in the direction to actually go seek out that step to get help for themselves. And these are sort of examples of things you might say if you do notice the symptoms we were talking about earlier, just to sort of start that conversation. And if you are in a position to offer support to someone else, really the best way to do that is to offer support yourself and be a good friend, which often goes hand in hand. And that can look pretty simple along the lines of, oh, do you want me to accompany you to a group or meeting? Maybe it's just a ride there. Maybe all they need is just, transportation or someone to sit with them to say, hey, this is pretty normal. As a friend, you might want to check in on the friends you notice these symptoms in just more frequently, showing them that you're there for them. And it never hurts to learn more about mental health conditions yourself, because you can more easily spot them in yourself and other people, even maybe before they get too out of hand.
So switching gears to talk a little bit more on kind of the other side of, we've talked about how to notice signs, how to reach out for help, where to start with that. So talking a little bit more about things that you can do, or you can help, encourage other people in your life to do to work on more of that kind of prevention side, or even just kind of things that we can do in our own lives to take care of ourselves. So, things like really focusing on our emotions and being able to recognize, like, what am I feeling right now? What can I do about this feeling that's going to help me move forward? Having more kind of like healthy thought patterns to help you regulate how you're feeling. Different things like that, just to kind of check in with like the emotional side of ourselves that often goes neglected and that we in our society don't learn a lot about. We don't have classes on emotions or how to regulate emotions. So, trying to find ways for yourself to do that, or with the help of a therapist or someone else that has some good skills in that area. Like I mentioned, sometimes we see issues with like nutrition or physical exercise or sleep, kind of like those basic building blocks of kind of holistic well-being. When those things aren't maybe as in good of a place as we'd like them to be, we can also see some signs. So we know there's relationships between certain kinds of nutrients and mood changes. We know that if someone is not sleeping well, that they're going to have low energy, and that can contribute to feelings of depression and lack of motivation. So, and exercise, we talk about endorphins, that they make us feel good when we can exercise. So just different ways to think about more of that holistic sense of well-being. It's also important to make time for things that make us happy, things that make us feel positive, taking time to just kind of unwind, relax, do something that makes us laugh. Things that can just kind of help us take a step back from maybe the challenges we face, and focusing more on getting that balance of positive and negative experiences. Community building is, really about kind of whatever that means to you. So for some people, it's really about continuing to engage in, family relationships, or to really build friendship networks, or to get involved in a group where you, have similar interests, wherever you can feel more connected to the people around you. and feel like you have a sense of support from others. And then also things like spirituality, religion, or values, anything in your life that you kind of makes you feel like part of a bigger purpose or gives you a sense of meaning, something that helps you, kind of, again, take that step back from where you are and focus on the bigger picture of life can be really helpful. And then these are some kind of ideas of different coping skills, so different kinds of coping skills to deal with difficult emotions when they come up. So one is going to be more of that emotional release, so finding ways to be able to express, how you're feeling, to notice like, okay, I'm feeling really like lethargic right now. Maybe I'm feeling depressed. Maybe I'm feeling just like really anxious. Being able to kind of identify what it is, and sometimes that means expressing it. So, for example, we know that crying is a way to release cortisol from the body, that stress hormone. So it's actually a way that your body is helping you release that pent up energy. Being able to get that out can be really helpful. Grounding is another idea. So basically kind of I think of it as like getting out of your brain and into the world. So finding ways to kind of get out of, sometimes we get into like a brain kind of cycle. We think about things a lot, we ruminate, we think on the past or we think on the future more than we just are in the present moment. So finding ways to just kind of notice, like, even just like noticing like what are some things around me that feel pleasant. What is it like to just sit in this chair? Where do I feel the pressure as I'm sitting in the chair? Just kind of finding ways to get out of your brain and more into the physical world around you. Thought challenging is one that can be challenging for some people, but this idea that we can kind of like look at our thoughts and maybe try to be like our own detective, like find ways to say like, okay, that thought is not true, it's not helpful, how can I think about this differently? Or even just kind of thinking more in a self-compassionate way. So finding ways to remind yourself of like, okay, this is something that other people experience, I'm not alone in this, I'm going to make it through. I trust myself. Just finding kind of nice ways to remind yourself of the strengths that you have. Kind of related to that, self-love. So that can be, could be related to thoughts, but maybe more of just sort of like, getting a manicure or taking a bubble bath. Kind of just finding ways to like give your body and your mind the care that it needs when we're so often stressed and, pulled in a million directions. Distraction is, I think, the one that most people often use. Everyone likes to watch Netflix and relax after a stressful day. And I think it has a good value. Like there are times when if you're feeling just like super stressed, like your brain needs a second to not think. So I think it's one of those things to use in moderation and to think about, is there a situation where maybe you don't want to distract? You really want to figure out like what's going on and try to figure out another way to handle that or, process what you're feeling. But again, it can be used very helpfully in some situations. And then accessing your higher self is kind of like in the previous slide, thinking about like spirituality or values. So finding things in life that help you take a step back, look at the bigger picture, and think about or doing things that make you feel good, make you feel like you're helping, other people in the society around you.
So relaxation is an effective coping mechanism for stress, and when practiced, you can actually see the results in like lower heart rate and lower blood pressure, and improved concentration, confidence, etc. Breathing strategies and meditations are good ways to do this, and it helps to calm emotions and clear the mind from anxious and racing thoughts. On this slide, the picture outlines a deep breathing relaxation skill, but there's also a lot of cool resources available for free elsewhere. There's a lot of free videos on YouTube that are guided meditations and relaxations. There's also podcasts aimed at relaxation and really cool phone apps. Some of those are Headspace, Virtual Hope Box, Calm, Stop, Breathe, and Think and Relax. Those are all, I think, free apps, but some of them have in-app purchases, but all of them are aimed at meditations and guided relaxation exercises. And lastly, relaxation doesn't necessarily have to be a sedentary activity. I know a lot of the times like you do see breathing exercises like this, but it's really what works for the individual. So it could be exercise like yoga or swimming, or it could be taking a walk and really just relaxing your mind. And so at this point, I just would suggest to think back on the presentation and think of the ways you currently de-stress or ways that you might want to de-stress in the future.
So just a quick overview of our services. We're in a pandemic. We're doing things a little bit differently as everyone is. So the biggest change to be aware of is that we're not doing any in-person counseling, which for some people is kind of annoying, but for some people is really helpful in getting them in the door. So hopefully, we can kind of help meet your needs as best we can. So basically with intakes, if you would like to schedule, or if you know someone that wants to schedule and want to encourage them, the best way to reach us is through our phone number there. Just give us a call. Our front desk woman will help you figure out, when to get in, can get you an intake appointment, and then we will kind of move forward from there and figure out what services make the most sense. So this is a free and confidential service for all students, undergrad and graduate students. And it's kind of included in your fees. So I really encourage you, if it's something that you're thinking about, even just want to kind of get a sense of, would this be helpful for me, just to try it out, because it's free, and it's kind of your right as a student here to take advantage of our services. So we offer individual and group counseling. We have a few groups going on. Feel Better Fast, an anxiety management group, and then a relationship group. And then of course we also do individual counseling, so meeting one-on-one with a therapist. And we also offer some career and educational counseling. So if you're more concerned about like academics or your career options or what you want to do, we also can kind of discuss some of those things with you and do some different kind of measures and assessments to help you figure some of those things out. And we also listed the crisis numbers there. So, if you ever find yourself in a crisis situation, or if you know someone or find out someone who is, just maybe something to keep in mind that there are lots of, you can call us when we're open, or we also have, there's kind of 24-hour numbers to call. So there's always someone to help you if you need some assistance. So that is it for us. Thank you for joining us today and listening. And if you have questions, you can give us a call and we'll help you as best we can. So thank you.
Thank you.